Hillrom presents the MetaNeb System 4.0, a revolutionary respiratory product designed to enhance secretion removal and help prevent or treat atelectasis in the acute care and extended care environment. The MetaNeb System 4.0 is a lung therapy device that provides 3 therapies in one device: lung expansion, secretion clearance, and aerosol.
This video will provide an overview of the product, describe how the product works, and review the instructions for use.
The MetaNeb system is indicated for mobilization of secretions, lung expansion therapy, the treatment and prevention of pulmonary atelectasis, and also has the ability to provide supplemental oxygen when used with compressed oxygen. Patients who are at risk for a pulmonary complication may benefit from using the MetaNeb system. Factors that could put patients at increased risk for pulmonary complications may include the duration of surgery, types of anesthesia and sedation, impairment of respiratory muscle function, alterations in respiratory drive, decreased lung volumes and surgical sites such as thoracic resections, coronary bypass grafting, upper abdominal surgeries, head and neck procedures, some orthopedic procedures, and patients with post-surgical pain and splinting. There are also patient-related risk factors for pulmonary complications to be aware of, such as the patient's age and general health, smoking history, immunosuppression, recent respiratory infection, productive cough or wheezing within 5 days of surgery, immobile or difficult-to-move patients, obesity, or trauma-related injuries such as rib fractures, flail chests, and head or high-level spinal cord injuries. Patients with chronic diseases and conditions may also be at risk. Chronic respiratory disease such as COPD, asthma, cystic fibrosis, and bronchiectasis can put patients at higher risk for pulmonary complications. Chronic neurologic diseases or conditions that affect the brain, spinal cord, motor nerves, and muscles may put patients at risk due to respiratory muscle and diaphragm dysfunction, spinal or thoracic deformity, hypoventilation, ineffective cough, bulbar dysfunction, or dysphagia and aspiration. The FDA has cleared the MetaNeb system for adults and children over the age of 2 years old. The absolute contraindications are untreated tension pneumothorax and untrained or unskilled operator. The relative contraindications are history of pneumothorax, pulmonary air leak, recent pneumonectomy, pulmonary hemorrhage, myocardial infarction, and vomiting. The MetaNeb system is a therapeutic device developed to provide effective lung expansion therapy, secretion mobilization, and to treat and prevent atelectasis. Let's take a closer look at the device. The MetaNeb system provides 3 therapies in one system: lung expansion, secretion clearance, and aerosol delivery of medication. The system has 3 operation modes. CPAP, or continuous positive expiratory pressure, is a therapy that expands and holds the airways open while delivering medicated aerosol. During the CPAP mode, aerosol combined with continuous positive pressure and increased flow is applied to the airways to help expand and hold airways open. In CPAP, the inspiratory flow and the expiratory resistance are clinician set. Flow during both inspiration and expiration helps to prevent or reverse atelectasis. This allows air to move beyond the retained secretions to aid in secretion mobilization and reduce the incidence of air trapping. CHFO, or continuous high-frequency oscillation, is a therapy that oscillates the airways with continuous pulses of positive pressure while delivering medicated aerosol. During CHFO mode, medicated aerosol combined with continuous pulses of positive pressure are delivered to the airways to loosen secretions. Continuous high-frequency oscillation during both inspiration and expiration forms a pressure gradient to the small airways where secretions are trapped. This pressure gradient creates accelerated expiratory airflow to mobilize secretions toward the large airways, where they can be cleared by coughing or suctioning. Aerosol mode is for the delivery of aerosol only. In this mode, CHFO and CPAP are not available. Alternating between continuous positive expiratory pressure and continuous high-frequency oscillation contiguously is referred to as a metatherapy treatment. A metatherapy treatment maximizes efficiency for patients and clinicians by combining lung expansion, secretion clearance, and aerosol delivery into a single integrated therapy cycle. A metatherapy treatment may be as short as 10 minutes and eliminate the need for multiple devices to provide these 3 therapies. The MetaNeb system's mechanism of action is based upon the principle of the Venturi effect. The Venturi effect is the reduction in fluid pressure that results when a fluid flows through a constricted section of tube. The constriction will cause an increase in the velocity of flow, which then causes a corresponding decrease in pressure. In the MetaNeb system, the Venturi is located on the handset. It is located between the therapy gas and the patient opening. As the gas passes through the narrowing passage of the Venturi throat, it increases in velocity, which in turn serves to drop the surrounding pressure. Additional gas is then entrained from entrainment ports as well as the nebulizer. The increased volume of gas continues toward the patient and is delivered through the appropriate patient interface. The Venturi functions as a flow amplifier that responds to the lungs' compliance and resistance. It is also a safety mechanism that prevents over or under distension. The MetaNeb system configuration includes a controller, stand, and disposable circuit kit. The circuit kit comes with 2 adapters and a black occlusion ring. The controller's components include a pressure manometer, mode selector switch, higher-lower switch for the CHFO mode, CPEP flow adjuster, circuit tri-connector port, master on-off switch, oxygen gas connector, and the mount bracket. The stand components include a pole and base. The assembly instructions are included with the stand. To move the stand, unlock the 2 locking caster wheels. Move the stand to the applicable location and lock the 2 caster wheels. The MetaNeb controller bracket is attached to the stand and the height can be adjusted to comfort. To assemble, loosen the knob on the bracket arm. Put the controller on the pole. Adjust the controller to the applicable height on the pole and then tighten the knob on the bracket arm. Attach and hand tighten the oxygen hose to the connector on the controller. Install the applicable hose adapter on the free end of the hose as necessary for your facility. The MetaNeb system's disposable circuit components include a mouthpiece, selector ring to adjust resistance, handset, biofilter, tubing, nebulizer, orifice indicators. The other accessories include a 22mm by 15mm adapter, a 22mm by 22mm adapter, silicone adapter, and a black occlusion ring. When using the MetaNeb system in line with a ventilator, use the black occlusion ring included with the circuit in place of the blue selector ring. The black ring will completely occlude the exhalation orifice opening to provide a closed system. When preparing to attach the circuit to the controller, note the orientation of the tri-connector port. In order for the circuit to fully seat, the tri-connector port needs to be in the correct orientation. It is important that the circuit is fully seated in the tri-connector port. You may feel some resistance when the circuit meets the rubber gaskets. Continue to push until the circuit is in full contact with the faceplate. Do not force the circuit onto the controller. Turn the connector 45 degrees counterclockwise to lock the circuit into position. Remove the nebulizer from the package. Assemble the nebulizer cup before you attach it to the circuit. Make sure the green cone within the nebulizer stays intact. Connect the nebulizer to the nebulizer port on the bottom of the handset. Connect, but do not twist the nebulizer hose of the tubing to the bottom of the nebulizer. Make sure to push the bushing all the way onto the nebulizer stem. For complete instructions, see the MetaNeb System User Manual. The MetaNeb system allows for 4 different patient interface options to the handset on the disposable circuit: a mouthpiece, a facial mask, a flex tube adapter to a tracheostomy, or a connection to an inline ventilator by connecting to the inspiratory limb of the ventilator circuit. Attach the mouthpiece to the handset by inserting the mouthpiece at a 45-degree angle and gently push it in and twist to the correct orientation. Another configuration is using a mask instead of the mouthpiece. To connect the mask, use the appropriate adapter provided with the circuit. Connect the mask to the circuit via the adapter. If the patient has a tracheostomy, a flex tube adapter should be used to connect the circuit to the patient's tracheostomy. The flex tube adapter is not included with the circuit. For patients on a ventilator, a spring valve T adapter should be used to connect the circuit. This adapter is not included in the MetaNeb disposable circuit kit. When using with the mouthpiece, face mask, or tracheostomy, there are 3 levels of positive expiratory pressure resistance available on the handset. The 1-dot position is the largest opening with the least resistance. The 2-dot position is the mid-sized opening between the least and most resistance. The 3-dot position is the smallest opening with the most resistance. For complete instructions, see the MetaNeb System User Manual. Now let's review setting up the MetaNeb system. Before beginning a patient treatment, complete the pre-use check. First, connect the free end of the oxygen hose to an approved 50 psi oxygen source. Connect the circuit to the controller. Select Higher. Set the mode to CHFO and then turn the selector ring on the handset to 3 dots. Turn the master switch on. Occlude the patient opening of the handset. Watch the pressure gauge for 5 seconds. The average pressure fluctuations should not be less than 15 or more than 30 centimeters of water pressure. Turn the CPEP flow adjuster counterclockwise to full flow. Set the mode to CPEP. Make sure there is a peak pressure occurrence of not less than 20 and not more than 30 centimeters of water pressure. If the device is not within the parameters specified above, do not use the unit. Contact Hillrom Technical Support to discuss your warranty options. For complete instructions, see the MetaNeb System User Manual. Now we will go over the metatherapy treatment protocol. The common strategy for frequency of metatherapy treatment ranges from 2 to 4 times daily. The patient's response to the therapy should determine any frequency adjustments. The patient should be in an upright and comfortable position if possible. Connect the MetaNeb system to an approved 50 psi oxygen source. Fill the nebulizer with the prescribed medications, if applicable. Set the mode to CPEP. Turn the CPEP flow dial all the way clockwise to the lowest position. Set the selector ring on the handset to the 1-dot position. Set the master switch to the on position. Adjust the CPEP flow to observe the aerosol that comes from the patient end of the handset. Attach the patient interface to the handset. Optional interfaces include mouthpiece, mask, or a flex tube adapter to a tracheostomy. If using the mouthpiece, remove the mouthpiece from the package. Attach the mouthpiece to the handset. Insert the mouthpiece at a 45-degree angle and gently push it in and twist to the correct orientation. Now you're ready to administer the treatment. Instruct the patient to inhale and exhale slowly for 3 to 4 seconds through the handset. Encourage the patient to continue to inhale and exhale slowly. Continue CPEP mode for approximately 2.5 minutes, adjusting the CPEP flow and selector ring to achieve a therapy that is comfortable yet challenging for the patient or as prescribed. Move the percussion rate switch to the higher setting. The percussion rate switch provides a percussion rate of 170 BPM at the lower setting and 230 BPM at the higher setting. Tell the patient that the mode will now change to CHFO. Instruct the patient to continue to inhale and exhale through the pulsations. Encourage the patient to keep lips firmly sealed around the mouthpiece and keep their cheeks firm to prevent air and pressure loss. Change the percussion rate per patient tolerance or prescription. Continue CHFO mode for approximately 2.5 minutes. Continue the metatherapy treatment alternating between CPEP and CHFO modes for 10 minutes or until the nebulizer is empty. When the treatment is complete, turn the master switch off. Disconnect the circuit and store the MetaNeb system for future use. When you store the circuit, keep the tubing attached to the bottom of the nebulizer cup and disassemble the top of the nebulizer from the handset. Therapy will be discontinued per facility protocol or when one of the following occurs. Secretion clearance is less than 5 cc per treatment for a 24-hour period. The post-therapy chest exam shows an absence of retained secretions and atelectasis or breath sounds have become clear or have improved. Patients should be evaluated every 24 hours while on the MetaNeb system to ensure an acute change has not occurred. For complete instructions, see the MetaNeb System User Manual. Now we will go over the protocol for using the MetaNeb system in line with a ventilator. Inline use of the MetaNeb system with a ventilator ranges in frequency from 4 to 8 times daily as determined by the patient's response to therapy or per prescription. Connect the MetaNeb system to an approved 50 psi oxygen source. Make a note of the current ventilator alarm and mode settings. The patient should be in a position to maintain the head of the bed angle of greater than 30 degrees if possible. Here's how to prepare for inline use. Remove the blue selector ring from the patient end of the handset. Install the black occlusion ring to make sure the exhalation orifice is blocked. Put a spring valve T adapter into the inspiratory limb of the ventilator circuit. Fill the nebulizer with the prescribed medication as applicable. Set the mode to CHFO and set the percussion rate to higher. The higher-lower switch provides a percussion rate of 170 BPM at the lower setting and 230 BPM at the higher setting. Change the setting per patient tolerance or prescription. It is important to place the master switch in the on position before connecting the handset. Now you're ready to begin treatment. Connect the handset to the spring valve T adapter using the 15mm by 22mm adapter included with the MetaNeb circuit kit. Monitor the patient response to the therapy and continue the treatment for 10 minutes or per the facility protocol. Adjust the alarm parameters as necessary while the MetaNeb system supplies inline therapy. Suction secretions as necessary during treatment. Do not leave the patient during therapy and be prepared to suction. Remove the handset and adapter from the spring valve T. Cap the spring valve T before turning the master switch off. Return the ventilator alarms and modes to their previous settings. Monitor and document the patient's tolerance during and after the treatment. Empty the medication from the nebulizer and store in accordance with institutional protocol. Follow your institutional guidelines for infection control. Therapy will be discontinued per facility protocol or when one of the following occurs. Secretion clearance is less than 5 cc per treatment for a 24-hour period. The post-therapy chest exam shows an absence of retained secretions and atelectasis, or when breath sounds have become clear or have improved. Patients should be evaluated every 24 hours while on the MetaNeb system to ensure an acute change has not occurred. For complete instructions, see the MetaNeb System User Manual. The MetaNeb System 4.0 is a revolutionary respiratory product designed to enhance secretion removal and help prevent or treat atelectasis for patients in the acute care and extended care settings. Metatherapy treatment maximizes efficiency for patients and clinicians by combining lung expansion, secretion clearance, and aerosol delivery into a single integrated therapy cycle. A metatherapy treatment may be as short as 10 minutes and eliminate the need for multiple devices to provide these 3 therapies. We hope you found the information provided valuable. To learn more about the MetaNeb system, we recommend you visit the website at metaneb.com, the MetaNeb System User Manual, or contact your Hillrom account executive. Thank you for taking the time to learn more about the MetaNeb system.